Hello and welcome back to Celebrate Life, Celebrate Pregnancy Week 4. This is your friend Parinita Rohrra. Before we begin to understand the developments happening in week 4, let us quickly understand what has happened in the last 3 weeks. You must have ovulated by now, thereby releasing an egg which must have met with a sperm, and together they must have joined to form a new cell body called the zygote. The zygote must have travelled through the fallopian tube to the uterus and attached itself to the wall of the uterus. Until and unless it has attached itself to the wall of the uterus, you cannot consider yourself pregnant. And now, how do you know that you are pregnant? Because you have gone through some pregnancy tests. Your body releases an HCG hormone which turns the pregnancy test positive and also turns your whole world upside down. So now, by week 4, conception, fertilization and implantation have all occurred, and your baby is going to grow really fast in this week. It is about 0.4 mm long, the organs are developing, the blood is pumping and the heart has started beating. Also, the amnion sac and the yolk sac have developed. The amnion sac fills with amniotic fluid which protects the embryo, while the yolk sac produces the blood and helps nourish the embryo until the placenta takes over. And now coming to the blastocyst, which is a multiple cell body. Let's see what's happening to all these cells. The outer cells reach out to form links with the mother's blood supply. The inner cells form into 2 and then later into 3 layers. Each of these layers will grow to be different parts of the baby's body. The inner layer, called the endoderm, becomes the breathing and digestive system, including the lungs, stomach, gut and bladder. The middle layer, called the mesoderm, becomes the heart, blood vessels, muscles and bones. The outer layer, called the ectoderm, becomes the brain and nervous system, the eye lenses, tooth enamel, skin and nails. So now we just saw that though the size of the baby is hardly a centimeter, there is so much that has happened to it and you. Now this is also the week when you are expecting to miss your period. There is something called an implantation bleeding which may happen and you may pass off as the approaching period. In fact, all these symptoms of the 4th week, which are actually early signs of pregnancy or early symptoms of early pregnancy, for example bloating, cramping, mood swings and backache, are all signs of the approaching period, the one which will never arrive. We will soon come back with the proceedings of 5th week on Celebrate Life, Celebrate Pregnancy. Do send in your queries and feedback on the email ID given below. So goodbye for now and breathe, chill and relax.